Hello and welcome again to another episode of Retire Wise, a podcast that's a partnership between Retirement Living Associates and Retirement Resource Guide. Today I'm happy to be joined by Mary Bethel. Mary has been active in the aging community in North Carolina, supporting programs and policies for a few years. A few years, and we realized just a little while ago that we were once working in the same department in state government. That was a couple decades ago, but great to see you today. And very interested to get your perspective on several things that are going on both in the state of North Carolina and obviously in the United States and really around the world with the demographic surge among older people. North Carolina is trying to be proactive in large part because of activities that you've been involved with, but you've been an integral part of an effort over the last few years to get a plan together so that as this demographic wave of seniors really impacts the state, that we're prepared. And so I want to talk to you a little bit about a plan that has been developed. All ages, you better say
all ages, all stages, and C.
Yeah, all ages, all stages, and C. And then out of that have come a large number of recommendations on things that the state can do or people in the state can do to better prepare to assist folks that are going through the aging process. And then specifically, I believe you've said that there are 41 of those items, or 40 some, that require some legislative involvement. And I just kind of want to hear from you what you think some of the key issues are that are going to require our political forces to come together to improve the lives for older North Carolinians.
Well, glad to share a little with you. Actually, the plan is a plan for 10 years, and we're focusing on this year and next year and what we can get done. And there were 41 recommendations in the plan for these next 2 years, of which 14 of them have some legislative significance.
14. I got my numbers.
Yeah, we definitely would have our extra work cut out for us.
It might take more than 2 years.
Exactly. But there are things that are top priorities in the state that we want to work on, and these go all the way from housing issues to issues regarding helping people save more, to looking at things about how we better support family caregivers, things of that nature, and get more funding for services and supports. It is interesting that since the plan was developed, our state has been dealing with Hurricane Helene, which of course has taken a lot of attention, rightly so, and a lot of the action of the General Assembly has been tied up with that. We've also had a lot of activity going on at the state and federal level relative to legislation and budget discussions and things like that have had an impact on things. One of the most important things I think that everybody wants to support that's kind of in the aging arena is the reinstitution of a study commission on aging. North Carolina had one for about 30 years, and people say, well, why does that make any difference? Well, the reason that a commission makes a difference is that this is a body that's appointed by the General Assembly. It has legislators as well as experts on issues related to aging in this case that would be on that. And they study issues and then make recommendations to the General Assembly. So issues already get a head start that way. Plus you've got legislators that have served on the commission that can now be advocates for and folks that can take the bull by the horn and do things to get things moving. So we think that would be a way of trying to get a lot of the issues that we want to be addressed out there initially. A couple of
I imagine you probably served on that commission.
Well, actually, I was kind of behind the scenes type things, advised, and things. Some of the other things that we particularly want to be focusing on this next legislative session is going to be a program called Work and Save. We now know that a lot of folks don't save like they used to. So when they get older and sometimes have health issues or need long-term care or things like that, they don't have the resources to cover that. So one of the things this Work and Save program would do, which a lot of other states do have, by the way, is it allows a public-private partnership that would set up a mechanism that people that don't have the option through their employer to do a 401k or any retirement savings, the state would set up this entity that would act as a 401k.
Okay.
And then people could pay into that and save that way. We know that the best way to get people to save is to put it in a savings account before they get their hands on it, for
It's
sure.
certainly true for me.
Exactly. So that's got bipartisan support, and we're hoping that that will move in the next legislative session.
Yeah, that's great. And you said other states are
Other states have already done
It's
it,
been
yeah.
successful.
And ARP North Carolina has been one of the real proponents of that and has done a good job of keeping it on the radar, for sure.
I'd heard you say previously that we're in a period of time now where it's all hands on deck.
It is all hands on deck. And let me mention one other issue, and I'll come back to that all hands on deck. One of the other big issues that we're working really hard on is property tax issues. We have property tax relief programs in North Carolina, but they have not been modified or updated in a long time. And we've got communities in North Carolina right now where people are at risk of losing their homes and not being able to stay there because they can't afford the property taxes. Particularly in a lot of larger metropolitan areas where home prices have really, really gone up. And in some communities where you've got people who have been in homes for 5-6 decades and the communities are transitioning, people come in and buy properties, then tear the houses down, and they'll build much more expensive homes, which therefore greatly increases the property tax value of those that have been there a long time. Now, in North Carolina, our property tax laws basically had to be done uniformly across all counties. So if a place like Wake County or Mecklenburg County, whatever, wanted to do more to help people with property taxes, right now they can't do it. So it's kind of a hot issue. Last year, I believe there were 15 bills introduced in the General Assembly related to property tax relief, either for older adults, persons with disabilities, or veterans. So we think this is still going to be an issue. It gets a lot of traction until they start seeing how much revenue a county would lose.
And obviously there's the revenue issue, but one of the issues is housing, obviously, for seniors. That's such a big issue, and this really does directly impact that. If you can no longer age in place in a home that you've lived in for 30 or 40 years, and you have to sell it because you can't afford the property tax because you're on a limited income, then you're going to have to go elsewhere, and you're going to have to find somewhere to live that you can afford, and all of those things. I spent a number of years in the mortgage industry, and so understanding how the value of home ownership, and still, even in North Carolina, over 65% of people own their own homes.
Yes.
So that's they do it because of the security and things of that nature, but it also has become a financial benefit to them. But if we're taking that away with the property tax increases, then we're really sort of challenging the whole system upon which they built their lives. And I think you would find that all hands on deck, there'd be a lot of people from a lot of different areas that would be supportive of trying to preserve decisions that were made 3 and 4 and 5 decades ago.
Yeah,
that
things change.
Things change, and they don't have the opportunity those people don't have the opportunity to make a new plan.
Exactly.
That's right.
Yes, sir. It is a challenge. It is a challenge. But I mentioned that I would come back to the issue about some of the challenges that we have right now.
Yeah.
There's a lot of things going on, both at the state and federal level, that impact a lot of what we want to do. Unfortunately, right now we're finding ourselves playing a lot of defense versus offense and trying to get things moving forward. We still don't have a comprehensive state budget for North Carolina, and there's some nonprofits that do good aging work in North Carolina, like North Carolina Senior Games, that are caught in that squeeze of not having a budget, that have appropriations they've had for years that now don't have that because of not having a comprehensive budget. One of the big issues that currently is going on in North Carolina is the fact that not enough money was appropriated initially to fund Medicaid in North Carolina for basically this next year that we're in, or the year we're in right now. And it's really important to older people because 21% of Medicaid recipients in North Carolina are either over 65 or disabled, but they account for, it's about 55% of Medicaid expenditures.
Right.
So, and people don't realize that 2/3 of people in North Carolina in nursing homes are on Medicaid. And they didn't go in, many of them didn't go into nursing homes on Medicaid, but if you're there for any length of time, it doesn't take long for that nest egg to go away.
That's right. That's right.
And
we talk about in our industry, in the retirement community industry, what we call the forgotten middle. And most people think, oh yes, the
Right.
Medicaid is for the poor. Well, anyone can become poor.
You can. You can.
You may start as fairly well off, or you thought you were when you weren't sick, but once you become sick, your circumstances can change in a hurry, and there's the forgotten middle that we talk about. Medicaid is available if you have very limited resources, and those that have significant resources can pay for their own care.
Yeah.
The folks in the middle can't afford the care
Yeah.
themselves and don't qualify for Medicaid. So
Exactly.
it's a conundrum that really faces folks sort of across the income spectrum.
Exactly. Well, because of this budget shortfall, which basically the House, the Senate, and the governor have all agreed of how much money needs to be appropriated, um, North Carolina Department of Health and Human Services, effective October 1st, started making cuts, anywhere from 3% to 10% for anybody who was providing Medicaid services. That's all the way from home care to assisted living, personal care services there, and to skilled nursing, rehab, things of that nature. So it's a real issue because some workers have already experienced pay cuts. You've got providers that have decided they want to do Medicaid anymore. You've got some that are saying, okay, what can I cut right now that I don't think I can have to have immediately. So it's as longer this drags on, the more impacts we're going to see in the state.
And given the demographics that are coming, we need to get a plan.
Yes, we do.
Because the challenge is only going to become greater. The expenditures are only going to become greater because the number of people that are in need of those services are increasing so dramatically. So there's a lot of work to do, and some common ground needs to be found for sure.
Yeah.
What other issues would you point to?
Yeah, another challenge that we've got, which is really going to impact North Carolina, is HR 1 at the federal level, reconciliation bill, or I think a lot of folks have heard it referred to as the One Big Beautiful Bill.
Oh yeah,
yeah, exactly. So it was debated this summer, signed into law by the president on July 4th, of course. It is also is going to impact a lot of state budgets. North Carolina could lose $50 billion in funding over 10 years. Which will impact everything. Medicaid, and a lot of that $50 million is going to be just Medicaid. But then we've got big cuts in what they call Supplemental Nutrition Assistance Program, or SNAP, or food stamps, I think most people refer to it as. And that's going to have big impacts. Now, a lot of these changes won't take effect until after the elections coming up in 2026, but we'll begin to see them. We'll also begin to see, effective right now, that a lot of the subsidies that had been out there on the marketplace for health care, unless Congress acts, they're going to go away also. So you're going to have a lot of folks in North Carolina that are going to lose health insurance. There's going to be a lot of implications for the state budget, which will impact whether we get funding for home and community-based services for older people, whether we get funding for adult protective services in North Carolina, things like that, just when you look at the big budget picture. So it's a time of uncertainty, I think, for a lot of folks, and just trying to figure out what we need to do to move forward in this period of just not knowing what's going to happen.
Right.
Things.
And what we need is people to deal with facts, like the demographics.
Yes.
And understand that the real situation that people find themselves in, and and not worry so much about cutting today, or we need a plan that is sustainable for the next couple of decades.
Exactly. And one of the demographics things that we point out a lot is the fastest growing segment of the older adult population is 85 plus.
Right.
And that are the folks that are going to need long-term care services and supports the most.
That's right.
So if people haven't saved like they have in the past, and we have some uncertainty about what's going to happen with the ability of state and federal governments to pick up a lot of the tab, who's going to pay for services and supports that people need?
Right.
So,
Yeah.
but I think there's lots of opportunities that we have out here to make some real inroads on things, and we're looking forward to the challenge.
I think one of the things that works in support of coming up with a solution is that these issues are going to affect every family.
Yes, they
right?
are. It doesn't matter.
It's not that this is other people's issues. It's literally going to affect every family in significant ways, and so that's when consensus is built.
Yeah.
When so many people face the same things at the same time. Are there other issues or?
Well, I think one of the big issues is workforce.
Yes.
I mean, just people going into the field of aging in general, but particularly healthcare. We had a healthcare workforce crisis before COVID.
Oh, yes.
It's just gotten worse since then. So I think people are evaluating options when it comes to what they want to do. They're looking at pay, they're looking at benefits, they're looking at all those things. And we've got a lot of initiatives going on in North Carolina to look at what can we do relative to the healthcare workforce, particularly getting enough nurses. Direct care workers is a big issue. I saw something the other day that said by 2023 we're going to have 200,000 direct care worker positions open in North Carolina. So that's who's going to do that personal care service and things like that. And I have friends right now that they're going for agencies, but a lot of them are also looking at going online to social media to find people to help care for relatives.
Interesting.
So
interesting. Yeah, and as you say, that's only going to get more significant as the numbers increase. But yeah, I know there are plans and programs in place to provide support for family caregivers.
Oh yeah.
So respite care, things of that nature. The truth is that families are going to have to provide a significant portion of care for their own family members, but that is a hard job.
It is a hard job, and it also has great implications for our workforce. If someone cuts back hours at work or they give up employment in order to be a family caregiver, not only is that a loss to the employer, but they're losing Social Security benefits and other types of things too.
Right.
So
the impact is...
Yeah, it is staggering.
It is. Goes on and on and on.
And we need to do what we can to support families, as you said, with respite care, training resources, benefits, are the things that we can do to just ensure they can do the best job they can.
For sure. Well, thank you so much.
You're welcome.
It's been great talking to you, and thank you for your years of advocacy and all you're going to do in the future.
Well, thank you. I appreciate being invited.
Thank you. Again, that's this edition of RetireWise podcast. I want to thank you for tuning in.